The news in sign language. You can watch this bulletin of news live from our Facebook page on DSTV channel 278 or at www.gbcghanaonline.com. The Director of Public Health at the Ghana Health Service, Dr. Bedusa Akodie, says the dynamic of the coronavirus disease has been known to progress through mild, moderate, severe, and then to critical stages, at which time death may occur.
Smokers, he says, have been observed to be high at risk with severe symptoms when they acquire the virus. According to Dr. Bedusa Akodie, close and protected contact is a known mode of acquiring the virus, as research into airborne spread is still ongoing.
When someone is exposed to the germ or the virus, there are a series of activities that will go on within the virus and also within the person, and it starts from anybody who is susceptible. That means that when you are exposed to the virus, you can have infection. And being a new virus that no one has full-blown immunity, almost the entire population in Ghana as well as the entire global community are susceptible. Studies are ongoing, and sooner you have the proportion that are exposed, that are infected, but these are not very clear out there. Those that are infected, a good proportion may be symptomatic or signs and symptoms, and a good proportion may also not show any symptoms at all. There is a sliding scale behavior of this virus. Those children under 10 years, they clear the virus rapidly, and those people over 40 transmitted mostly through droplets and fomites during close, unprotected contacts. The airborne spread has not been confirmed or designated.
The World Health Organization, WHO, has cautioned health officers across the globe to stop using hydroxychloroquine in the treatment of the coronavirus disease.
WHO currently, in a news item, have discontinued the use of hydroxychloroquine on safety grounds. As I speak now, of course, we wait for the formal communication, but the case management team now are meeting to take a decision on what to do. We only use it for critical cases. We don't use it for routine cases. Those who are being managed at home do not take hydroxychloroquine. So the case management team is, as we speak, are in a meeting to quickly take a decision on what we do, and whenever we do that, they will be adequately communicated.
And the Ministry of Health has received 10 new ventilators to be distributed to some health facilities across the country. This was announced by a Deputy Minister for Information at a COVID-19 media briefing in Accra.
These ventilators are being received from Peawood Limited and Tema, bonded terminal. Distribution of the ventilators will be as follows. Gapoha International Maritime Hospital, Tema, 2 ventilators. Tema Government Hospital, Tema, 1 ventilator. Komfanoche Teaching Hospital, 2 ventilators. South Suntreso Government Hospital, 1 ventilator. Sunyani Regional Hospital, 1 ventilator. Ho Teaching Hospital, 1 ventilator. Oda Government Hospital.
The Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, also disclosed how much government is spending per test per person on COVID-19.
We've so far done about 21,000 plus tests. And the conservative estimate for each test ranges between $50 to $65 per person. If you look at the kits, the extraction, the operational costs, and the human resources costing about that. This excludes the cost of picking a sample and delivering it to the lab. And so it's quite a very expensive undertaking, but it's worth what we're doing.
As of the 24th of May 2020, the country has recorded 156 new cases from 5 out of the 16 regions. 15 of the cases have been identified as severe. According to the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaji, Greater Accra still leads with a total of 72 new cases. There have been 2,097 recoveries and 32 deaths. The total case count now stands at 6,964.
There are 15 cases who are severe. We don't have anybody who is in the critical position. They don't need any ventilator. For the confirmed cases and treatment outcomes, out of the 15 cases that I say are severe, we have 4 at the UGMC, as University of Ghana Medical Center. Ghana East has 3. Whole Teaching Hospital has 1. Kolebu Teaching Hospital, Military Hospital has 1. We have about 800 people in isolation across the country. About half of that, or more than half of that, are in Accra, the Peace Center, and the rest are in various centers, isolation centers in Ashanti, and some of them are in hotels in the rest of the region being isolated. We have had about 10 regions have not reported a case. Greater Accra so far recorded about 4,835 cases, accounting for more than 80-85% of all the cases in the country. We have Ashanti recording 1,062, but they have 4 new cases today. Central has a cumulative figure of 306 with 13 new cases. Eastern has not reported a case for a while. Upper West, Upper East have also not recovered a case for a while. In fact, most of the cases in Upper East, they've almost all recovered. Volta has 10 new cases. OT has 26 cases. They've not had any new cases since then. And then we have Western North has had 2, 1 died and 1 has recovered, and so they are probably in the same state of currently no case.
Exercise ending today. Professor Michael Quay says the medical team has been recalled for an additional 2 days, Thursday and Friday, to allow MPs who have not taken the test yet to do so.
Every staff of Parliament to test for COVID-19. The press corps must also submit themselves to testing. Last week, it is imperative to inform that we should take this
for Foreign Affairs and Regional Integration for the smooth takeoff of the Africa Continental Free to withstand shocks that may arise in the years ahead. The minister's statement is in line with the 57th anniversary.
Several countries in Africa, Ghana inclusive, have had their economic inequalities that continue aspirations and our responsibilities to the citizenry. The pandemic has therefore put to a great test the determination and resilience of our continent. Mr. Speaker, this bleak outlook notwithstanding, Africa is optimistic of riding the storm and coming out successfully from the pandemic.
Because this, on the face value of it, looks as one-off, but we will have to build a certain statutory fund, COVID and after COVID, so that member countries will be motivated enough to make continuous support, both kind and cash, to build this fund, which will not only be used during this COVID, but overarchingly targeted at building our public health systems and then also strengthening existing institutions.
How can we ensure, Mr. Speaker, that we leverage on technology, for example? One of the lessons we should learn from this pandemic is that we should invest heavily in technology. If we do that, many can continue to keep jobs working at home. Many can continue to study online. Impressed with the ministers of the Africa Continental Free Trade Area.
At each time, begin to search deeper into the consciousness of the African and also to think about the way forward and how we generate support for ourselves and get the unity we deserve and need to move forward. It is also time to sensitize ourselves about ideas in what it means getting our youth, our women to understand the development process. Our youth, because the African Union has an agenda of bringing up a young population that can understand the need for development and the dire need for us to keep the peace.
A few weeks ago, help the small-scale businesses, because during this pandemic time, a lot of businesses collapsed, came down. People were unable to go to their normal businesses as it should be. When you come to Ghana, we did our best. And I must also commend every member in this house for what they did in their constituency. We were seeing them, we were reading them. It was a time that every individual got involved to curb the situation.
Professor Henrietta Joy Mensah-Bonsu and Emmanuel Unicolendi have taken their oaths as judges of the Supreme Court. They were formally ushered into the office by President Akufo-Addo of Justices of the Supreme Court to 18.
Professor of Law, Director, National Commission on Children, Ghana's representative on the Organization of African Unity's Commission of Eminent Jurists on the Lockerbie case, member of the National Reconciliation Commission, member of the Executive Council of the International Human Rights Network of Academies of Learning, member of the United Nations Secretary General's High-Level Independent Panel on Peace Operations, member of the Council on Foreign Relations Ghana, and current president of the Ghana Academy of Arts and Sciences. The Supreme Court with 39 years of legal experience.
It is important that you dispense justice in full accord with your conscience and the rule of law. You must ensure the strict application of the law and therefore without recourse to the political religion.
I have today taken on the onerous responsibility of a Justice of the Supreme Court of Ghana. As my favorite lines of our national anthem go, quote, with our gifts of mind and strength of arm, whether night or day, in mist or storm, in every need, whatever the call may be, to serve thee, Ghana, now and evermore. And so I here make the pledge that, as always, I will devote my time and talents to her call and serve her.
Is part of a small group of persons who have been appointed directly from the bar to the bench. He cut his teeth in the legal practice at Akufo-Addo Prempeh, which stands tall in the country.
Confirmation processes which were initiated on the advice of the Judicial Council, undertaken in consultation with the Council of State, and effected with the approval of Parliament, mean that Mr. Emmanuel Unicolendi has exhibited the independence of mind to hold this.
Adhere to the terms of the oaths that I have against. The fear of God in what promises to be a challenging but exciting and fulfilling journey, God. I shall, like Caesar's wife,
of the 4 persons nominated by President Akufo-Addo to join the Apex Court of the land to replace 3 others who are retiring from the service this year. The code *887 £100 will attract no service charge and is available on all major telecommunication networks. Making a presentation to some beneficiaries in Accra, the lead trustee, Justice Sofa Akufo, also announced that the trust has so far received 50.6 million Ghana cedis in total from individuals and organizations to support its work.
The platform short code is *887 *100#, and it is usable on MTN, Airtel Tigo, and Vodafone mobile networks.
In all, 6 organizations were at the office of the COVID-19 National Trust Fund, Kolebu Teaching Hospital, Nutrition Isolation Center. Others are Ni Odoikwao Family for the Osu Community, the ACK Foundation Ghana, and Association of Magistrates and Judges of Ghana. They were giving PPE, detergents, sanitizers, Veronica buckets, and food items, among others. The lead trustee, Justice Sophia Kufi Authority GRA, has put in place measures to grant tax reliefs to organizations that have supported the trust fund when they file their tax returns.
We are also happy to announce that the Ghana Revenue Authority has confirmed their tax returns. This is for the implementation of the tax incentives in support.
Senior Jamafe represented the beneficiaries to thank the trust fund for the assistance.
The Conference of Health Assisted Secondary Schools CHAS has proposed a mass COVID-19 testing of students teaching and teaching senior high schools before schools reopen. Now, such an exercise would make for easy identification and isolation of COVID-19 cases within the school community to prevent the spreading of the virus on campuses. He spoke to GBC News in an interview.
There is currently a national discourse on whether or not senior high schools in the country should reopen amidst the COVID-19 pandemic. The schools have remained closed since 15th March as part of measures to curtail the spread of COVID-19. However, in recent times, there have been calls for the schools to resume. But 4 teacher unions have, in a joint statement, registered their opposition to the reopening of the schools around this time. The 4 unions include the Ghana National Association of Teachers NAT, the National Association of Graduate Teachers NAGRAT, Tertiary Education Workers Union TEU, and the Coalition of Concerned Teachers. The Council for Private Schools is in the group pushing for schools to be reopened. Their reason is that they have faced financial challenges and as a result laid off teachers. The national president of the Conference of Heads of Assisted Secondary Schools, CHAS, Alhaji Yakubu A.B. Abubakari, has suggested that when the schools resume, students, teachers and non-teaching staff should first be tested for COVID-19.
We are suggesting that first and foremost, all staff, both teaching and non-teaching, should be screened and then gotten certificate to indicate that they are negative as far as the disease is concerned. Equally so, students should also be screened from their homes level, so that when they are coming to school, they come with evidence to show that they have been screened and they are negative. And at the entrance of each school, we must have the thermometer gadgets there to also screen them as they are coming into the school to ensure that indeed they are coming into the school with clean slates. Nobody has that challenge.
Now to Tema. To ensure availability of water country, especially in this period of COVID-19 when frequent hand washing is necessary, the Ministry of Sanitation and Water Resources and the Ghana Water Company have embarked on a community water distribution project. It started at Ningo Pram Pram.
Increase globally as society wages war against the deadly coronavirus. Everyone is required to keep social distance, wear face masks, drink enough water and frequently wash hands with soap under running water, all in an effort to stem the spread of COVID-19. Recently, however, taps have not flowed in certain parts of the Greater Accra region, a situation that could defeat one of the major anti-COVID-19 measures, the clean. One community that has experienced acute water shortage recently is Ningo Pram Pram in the Greater Accra region. The Ministry of Sanitation and Water Resources, in partnership with the Ghana Water Company, started a community water distribution drive at Ningo Pram Pram.
We have put in measures so that we can send water to areas that are having challenges with water supply. So currently we are here at Old Ningo to supply water to the community here. Earlier on, we had been to an old New Ningo and then Pram Pram Township. We had also sent water to Dawenya, Ponkokompe, Manchagboena, Ape Mami, and then the Presby Park.
In his faith address to the nation on COVID-19, President Akufo-Addo said government will ensure that Ghanaians enjoy water for free for 3 months. In line with this, the water company and the sector ministry have initiated a project called COVID-19 Free Water Project. Polytanks have been mounted in various communities for the purpose. The communication director for the Ghana Water Company in the Tema region, Mr. Samson Ampa, said the company is carrying out the presidential directive to ensure that people get water to wash their hands frequently to help curb the spread of COVID-19. A beneficiary, Madam Victoria Mamle Alipui, showed appreciation.
It's difficult to get free water as most owners refuse to comply with the President's directive. We thank Ghana Water for the assistance.
The leadership of the Coalition of Muslim Organizations Ghana, COMOG, wishes to associate itself with the National Chief Imam, gratitude to President Kufuor on Saturday 24th May for appointing Justice Isifu Imoro Tanko Amadu to the Supreme Court. This is the first time in Ghana's history that a Muslim has been elevated to that position. In his message to the nation during the virtual Eid al-Fitr on Saturday, he expressed his gratitude to His Excellency the President of the Republic for nominating and subsequently appointing Justice Isifu Imoro Tanko Amadu to the highest court of the land. In his address, the National Chief Imam said Justice Amadu's appointment to the apex court will serve as an inspiration to many for the Coalition of Muslim Organizations. Ghana COMOG expresses gratitude to the President and congratulates Justice Amadu, who has played a pivotal role in the affairs of the Muslim community in Ghana.
Also in this bulletin, Korea has presented assorted personal protective equipment, PPE, worth $50,000 to Zongos and other less privileged communities in Accra. The items are to help alleviate the difficulties within beneficiary communities and also help fight the COVID-19.
Zongos are sprawling, densely populated Muslim communities, often poverty-stricken, less developed, and underprivileged. In Accra, Fadama, Nima, Mamobi, Accra New Town, Ashamang, and Medina are clear examples. Medina, for instance, arguably has more than 70% of residents being Muslim, with almost 90% falling within the poverty bracket. The Member of Parliament for Medina, who is also a Minister of State at the Office of the Vice President, Alhaji Boniface Abubakar Sadiq, said, being fully aware of the poverty levels of residents of Medina, he knew their difficulty in accessing personal protective equipment, PPEs. For this reason, he appealed to the government and people of Korea through Ambassador Kim Sung-soo. The items delivered were disposable masks, hand sanitizers, Veronica buckets, tissue paper, reusable masks, detergents, disposable bins, and more, meant to combat to assist the marginalized and vulnerable in the Zango communities in Medina and beyond. The beneficiaries, Koreans, believe in strengthening the bond of friendship with Ghana, especially in such difficult times. And this $50,000 gesture is part of implementing the Korean Grant Aid and Technical Cooperation Program through the Korean International Cooperation Aid.
Andy, an Okada rider, left home to work about 2 months ago and has since not returned.
All efforts to reach him, according to his family, has proved futile. Anyone with information on Randy's whereabouts should report to the nearest police station or call his father, Mr. Emmanuel Kwao, on 0243 420 791, or his mother, Madam Mary Nati, on 0548 296 767.